Hello, my name is Mausham Kukar. I'm the Associate Professor of Oncology, and I'm the Program Director for the Complex General Surgical Oncology Fellowship here at Roswell Park. The institution has two core objectives: A, excellence in patient care, and B, excellence in training and education. And we want to do our best to train people to excel in whatever sphere they choose to be. Through this video, we'll love to give you a peek into the program, and welcome to Roswell Park.
Roswell is very unique. We're an NCI comprehensive cancer center. As people often don't know, we're the oldest dedicated cancer center in the United States. And so since 1898, we've just been doing cancer. We've had a surgical oncology fellowship here for decades.
Fellows start on day one, either on a clinical rotation or one of the research or non-clinical rotations during the first year. They jump right in and are able to start seeing patients in the clinic, start in the operating room, or get started on research projects.
You'll see complicated cases. You'll see patients that are offered clinical trials. Trainees have an opportunity to participate, enroll patients in clinical trials, even develop clinical trials of their own. And this will be really an important part of learning how to take care of these cancer patients now and also down the road.
I think anyone interested in cancer surgery has had the name Roswell Park somewhere on their list, no matter what. For me, Roswell was that perfect fit.
Everybody knows everybody. As a surgical oncology fellow, the medical oncology attendings will know you by your first name and last name. The nurses, pretty much everybody in the institute. And because of that emphasis on sort of a broad training, we set the rotations up that the fellows rotate with every attending.
You're on that rotation for about 3 months, which is nice because it kind of builds in some continuity. The attendings can get to know you. They kind of give you graduated autonomy as the rotation goes on.
You as a trainee aren't a stopgap. You're not filling in gaps in provider care or anything like that. Everyone's on the singular mission. So you're really here to learn and fine-tune your craft.
If I'm in the OR, the fellow's in the OR with me. A lot of times if I'm in clinic, the fellow's in clinic.
You'll do usually complicated cases, usually 3 to 4 times a week, and then you're usually in clinic about 1 to 2 times a week as well.
We find that the trainees are really impressed by our dedication and focus to doing minimally invasive surgery for complicated cancer patients.
We've got state-of-the-art robotic pancreas, robotic esophagus. We're doing robotic liver.
As a trainee at Roswell Park, you'll get exposed to the latest developments in robotic surgery.
Some of the things that we're really kind of proud of and that we use often are our surgical simulators.
With respect to the MIS and the robotics, we're certainly the leaders in the foregut program, especially minimally invasive esophagectomies and gastrectomies. We published a high volume series from the institution, and we have some of the best outcomes from these operations. If that's what piques your interest, I personally don't think there's a better place to train than here.
Education is one of the 3 cornerstones at Roswell. That was one of the original founding tenets of the Cancer Center, is to treat people with cancer because it's a unique disease, do research in cancer, and educate the next generation.
Our program as a whole has redoubled its effort to be dedicated to fellow education.
We use a combination of lectures, journal clubs, our multidisciplinary conferences to achieve this learning, as well as we use the Decker surgical curriculum to augment this.
What makes a good surgeon to outstanding surgeon is how can you tackle those challenging cases. And by participating in scientific research projects, that's where you hone those skills. We're very geared towards the results and publication and presentation. In year 2021 alone, we published 53 papers. In the year 2020, 47.
When you're a first year, you may not know kind of what you want to really research, and they provide a lot of opportunities for you to kind of see what's out there and work with several different people. For me, I know I was interested in Indigenous cancer research, and there's a Center for Indigenous Cancer Research, and the program here has been very supportive of me working with them.
People do a lot of outcomes research now, clinical research. We have the opportunity for the fellows to write clinical trials for in-house phase 1 trials that are being developed.
Each year, our fellows present at all of the national meetings, and this research advances the field.
Our fellows here have a ability to mix academics and learning new things here with a reasonable quality of life, because their on-call schedule is very manageable.
What'll happen is any given weekend, there's one fellow on call, one faculty member on call, and you cover all of surgical oncology: breasts, STM, GI, HPB, colorectal. But the way it's set up, having 8 fellows, it means that the fellows are on call one weekend every 2 months.
They can take advantage of many opportunities outside the hospital. You know, Buffalo is a city that has a lot of charm, theater and restaurants, and many exciting opportunities. So we find that the fellows really have a great quality of life while they're here.
I think Roswell Park is really a gem for the community of Buffalo. To have such experts in this city is excellent for patient care, and it shows with the community events and outreach how much the city of Buffalo loves Roswell Park.
There's just a unique culture here, and it's a combination thing. It's the size of the institution, it's the people who are here, it's the location, right?
With all the different places I've trained so far, this place has really stood out, that every single person that you meet in the hospital truly and deeply cares about doing the best for the patient.
More they get better, more they become the leader of each community. Those will be my colleagues. Moving on, they will be the surgical oncologist. That gives me a great pleasure.
So I did my residency training in Long Island, and I chose Roswell Park for my fellowship training. I thought I was going to be here for 2 years and move on, and here I am, 8 years later, stayed back as faculty, and I've still enjoying every single day.
Past fellows at Roswell Park have done extremely well. I mean, many go on to academic careers. A lot of them will thrive in private practice, taking on leadership roles both internationally and nationally in meetings.
If you are thinking in terms of impacts that you want to make within your fields, you should really consider Roswell Park.
I hope you guys have enjoyed learning about some of the unique and exciting opportunities we have here. To sum it up, I just want to focus on some of the unique strengths we have. Number one, most importantly, it's our robust MIS and robotics program. We have a fairly well-established robotics program in pretty much every disease site, including some of the internationally recognized leaders in this space. It's the teaching opportunities outside the ORs. So we organize a quarterly cadaver lab in conjunction with our University of Buffalo residents, where you can work on open procedures, laparoscopic procedures, and also robotic procedures on a quarterly basis, and work with our faculty to train more in that setting. In addition, we have a simulation lab, and we have also access to the Da Vinci's latest simulator, where we have these curriculums that are designed and they're actually built into your curriculum, so you're practicing on a routine basis. For our qualifying exam, our board pass rate is 100%. For the certifying exam is 94%, and these are well above the national averages, which range from 80 to 85%. We do provide a very robust, well-rounded training program, and we have good case numbers pretty much in every disease categories. As listed on the website, we are at least 1.5 to 2 times above the minimum case requirements for each category. As you may have heard, easy call schedule, 1 in 8 call weekends, plenty of help, mid-level help on the floors and in the operating rooms, plethora of research opportunities, whether it's basic science, translationals, or outcomes-based research. But most importantly, you'll be working with a group of faculty that genuinely care about your education, that will treat you as colleagues and are truly vested in your success. I want to wish you the best in this journey, and thank you for considering Roswell Park.